Senator Siewert.
Deputy President, pursuant to order, I present with pleasure the report of the Community Affairs Reference Committee on the care and management of younger and older Australians living with dementia and behavioural and psychiatric symptoms of dementia, commonly known as BPD-SD, together with the Hansard record and the proceedings and documents presented to the committee, and move the report now be printed.
The question is that the report now be printed. Those of that opinion say aye. Against say no. I think the ayes have it.
Motion in relation to the report.
Is leave granted? Leave is granted.
I move that the Senate take note of this report and would like to take note of myself. This committee inquiry, I think, it was a particularly important inquiry, and I would like to acknowledge the fact that Senator Lynn Thorpe made the initial referral in the first place. I'd like to take the opportunity to thank all the submitters and witnesses who gave so much of their time and expertise, and also to the Secretariat, who have once again done a sterling job for us. We make 18 recommendations, and I think these recommendations are very important recommendations if we are going to take seriously the issue of dementia in this country. Nearly 1.5 million Australians are currently affected by dementia, if you include patients, family, friends and carers. Dementia, in fact, covers a wide range of symptoms, including impairment of brain function, language, memory, perceptions, personality and cognitive skills. The type and severity of symptoms varies extensively. The committee particularly looked at the issues around behavioural and psychiatric symptoms, or what they call complex issues, behavioural issues around dementia. This can be caused by unmet need, physical or mental distress, illness, reactions to medications and other factors in the patient's environment. And this is particularly important to note, and I'll come back to those issues in a minute. This is an issue that will become increasingly prevalent as our population ages, and we've heard much of that. So we need to be taking seriously this issue and taking seriously our recommendations. This is one of our most pressing health concerns, and if left unchecked will become an increasingly large problem for our community, residential and aged care and community care if we don't get this right. As its starting point, the committee has recommended that the Commonwealth create a new Medicare item number that allows longer consultations with patients and family members and carers, who enable to help them to provide and have more time for a more accurate dementia diagnosis, because we heard that was a significant problem. Increasingly, more and more people will potentially have BPSD and will be cared for in the community, because nearly 70% of people with dementia are already cared for in the community. We are not prepared as a nation to handle the increasing prevalence of dementia, and we need to understand the issues around dementia so we can better provide care and support for people that have dementia. This is going to require a change in our attitude to addressing dementia and putting the person at the centre of care. At the moment, we heard a number of concerns and significant concerns about the treatment of people with dementia, but we also heard where there are very supportive and positive approaches to supporting people with dementia that in fact address the so-called perceived issues around dementia, and particularly the areas around complex behaviour needs. We also were given a very accurate, a much more detailed understanding of why some of these so-called behaviours and so-called violent behaviours happen, and that's mainly due to issues around, for example, prolonged or wrong medication, people being their environments not suiting their needs, people then being restrained. And that's an issue that caused some significant concern for the committee, and the committee was provided with evidence that seems to confirm that there is a significant overuse of psychotic medication to those in aged care and in community care for the control of BPSD. And we believe, the committee believes, that this overuse must not be allowed to continue. We are concerned about the reliance on restraints to manage dementia and complex behaviours, and we also point out and have the view that this is unacceptable model of care. We heard evidence also around physical restraints and people being locked in to facilities. However, and we've made a number of recommendations around the need to look at the issue of restraints, both through medication and physical restraints. And really importantly, we saw some really good examples how you change people's environment. You recognise that people's perceptions and cognitive skills have been are affected, and therefore you need to understand what is motivating the behaviours. And if you look at those motivations and understand them and provide significant and much better training to staff and carers understand why people are behaving the way they are, you in fact mitigate the use. And we went to Yarra Ambak in Warracamobile in Victoria and saw, I would say, first-rate care. Really first-rate care, where that care had significantly dropped the use to almost nothing, the use of medications. They didn't lock doors. They didn't even have a nursing station. Staff interacted with the patients and it became much more like a family environment. They had just established beautiful gardens. So in other words, you can do this. There is no need for the heavy reliance on restraints that are being used, both medication and physical restraints. We need to get our act together in this country to better support people with dementia, to understand what is causing these so-called complex behaviours and actually change our perceptions. We've made 18 recommendations around training, around better design for facilities and around tracking and monitoring the use particularly of medications. I'm conscious of time, so I will in fact curtail my contribution now to enable the Deputy Chair to also make a contribution.
Thank you, Senator Siewert.